Platelet-rich plasma. What is PRP? We draw some blood, we spin it down to the plasma, and we concentrate the platelets. The platelets are the little things that stop you from bleeding, and they found out that within these is lots of growth factors. The growth factors stimulate things to regrow. So athletes get them for sore muscles and sore joints, and for hair to stimulate hair growth. Because of the hair's growth cycle, the PRP, the results are seen 6 to 9 months, mostly because the hair cycle is so long. Exosomes. Exosomes are small vesicles. They're very, very small. They're not way smaller than a cell. They contain messenger RNA. They're made from stem cells, and the messenger RNA is the signals that tell things what to do and to regenerate and to regrow. So these things go down to the hair follicles and tell them to turn on. They work a little bit faster than the PRP alone. With our exosome treatment, we're also using the PRP, so with the exosome treatment, we're getting PRP and exosomes. So after the treatment, if it's the PRP alone treatment, we just ask you to rest for a day, and then the next day you usually feel pretty good. If it's the PRP plus exosome treatment, then we have you rest for a day or two, and you're a little bit more sore and a little bit in the hair. So we just have you rest, just do some gentle washing of the hair. All right, good. So we're doing the micropen depth 2.5 millimeters. We're doing a stamping technique. Our patient's all nice and numb. We're just doing a stamping technique, 2.5 millimeters. One or two passes is adequate. Do it in different directions. Overlap. So then just review the post-operative instructions with the patient, which is mostly just to rest. Mostly just to rest and gentle washing, no aggressive shampoos. Because we want the PRP and the exosome to just rest.
Mm-hmm.